Hi, I'm Dr. Megan Panico. I'm a board-certified pulmonary and critical care physician. I'm the medical director of Gaylord Specialty Healthcare and the medical director of respiratory therapy here. I went to University of Connecticut Medical School, and prior to that, I was actually a physical therapist and also went to the University of Connecticut. After UConn, I went to Yale for my residency, completed a chief residency in internal medicine, and then a pulmonary and critical care fellowship. At that time, I joined a private practice and I'm attending in the medical intensive care unit and also see patients in outpatient pulmonary private practice. I've been at Gaylord for over a year now. I oversee patients mainly in the Milne unit, but also throughout the rest of Gaylord Hospital who have come to Gaylord after critical illness or injury. Many of the injuries that we see or illnesses that we see include pulmonary injuries in patients that have been on ventilators that have been unable to wean from a ventilator. We also take care of patients that have had cardiac injuries or prolonged congestive heart failure illnesses. We have patients that come over on left ventricular assist devices that are waiting for cardiac transplant. We have pulmonary patients that have had transplant that then transition into an outpatient pulmonary program here. We really can take care of any patient that has had either a multi-trauma, has had a prolonged ICU stay related to septic shock, any type of infection, acute respiratory distress syndrome. We often see patients that have very severe baseline chronic obstructive pulmonary disease or congestive heart failure that they really just need a prolonged time to help them get better and get back to their functional lives that they had before this and hopefully return home, which is our goal for any patient that wants to. So the pluses about Gaylord, I think, is the multidisciplinary aspect that is taken to a patient's care. You have a pulmonary critical care physician, you have a hospitalist, you have respiratory therapists that are here 24 hours a day, you have speech therapists, physical therapists, nursing, and discharge planning that all work together. And what I see is the big difference between their acute care hospital stay and once they're able to come to Gaylord is we really move the focus from fixing their underlying medical problems to continuing to treat their medical problems and figure out a way for them to get their functional lives back to who they were before. If I, was approached by a family member who was trying to decide about coming to Gaylord, I couldn't say enough that I would want my own family members to come here. I treat patients in the medical intensive care unit when they're on the brink of death at times, and our real focus is trying to save their lives and get them through their ICU stay. And I can't wait till I can think about their next steps towards rehab. And the first thing that would come to my mind is a place like Gaylord Hospital, where really the focus can turn to how can we improve their strength and their breathing to the point where we can get them up out of bed, walking if possible, and truly start to think about who they were as a person before this, not just their medical problems. And I think Gaylord does a better job than anywhere that I've ever seen in doing that and really helping people get back to who they were.